All right, it is time for some better health and another Heart Month lecture coming up for Baystate Health. Today, we're talking about the heart's electrical system and latest treatments. This should be a fascinating conversation. Cardio electrophysiologist Dr. Fadi Shahhoub joins us now. Doctor, thank you very much for coming on today. I'd never even heard of such a role. So just briefly, can you, for the layman here, meaning me, can you explain the role of the heart's electrical system?
Absolutely. Thank you for having me on your program. I'm very delighted to be here to speak with you about this very important topic. So again, my name is Fadi Shahhoub. I'm one of the cardiac electrophysiologists. I'm a cardiologist at Baystate Medical Center, and I'm a specialized cardiologist in the heart's electrical conduction system. And I deal with treatment of abnormal heart rhythms, be it fast or slow, with the different modalities which we will speak about.
Well, that's very interesting there. And can you kind of talk then to the dangers? Is it common to have irregular heartbeats, I guess I would describe it as?
Yes, absolutely. So abnormal heart rhythms or arrhythmias are quite common. As a matter of fact, atrial fibrillation is the most common arrhythmia or abnormal heart rhythm that we encounter. It affects upward of 7 to 8 million Americans. And it is a great public health issue, and it definitely affects a great deal of people because it tends to be asymptomatic in a great deal of folks. And atrial fibrillation does increase our risk of having a stroke. So that's why I think it is an important issue to be aware of.
Yeah, no doubt about that. So with these heart lecture series then, is that kind of what you're getting into, letting people know who may be asymptomatic out there, likely not knowing that this is a problem for them? How do you break down to them that their current situation if they don't even know they have it?
Absolutely. So the goal of this lecture series is to go over the heart's electrical system, to go over what arrhythmias are, and to delve deeper into the different heart rhythm abnormalities, specifically atrial fibrillation, and how we can monitor it and how we can detect it early, so that we can treat it earlier.
Very interesting. So I'm guessing modern medicine probably helps in this. Is there technology that kind of boosts the treatments with this?
Absolutely. I mean, the treatment for heart rhythms disorders has changed dramatically over the past decade. The way we treat our patients 10 years ago is very different than how we treat our patients now. Nowadays, we have different modalities with minimally invasive procedures that we can perform to help treat these various forms of heart rhythm disturbances. We have catheter-based procedures, which are minimally invasive procedures that definitely help treat these arrhythmias.
Very interesting. So, Doctor, actually, we're going to pull this up. We just want to let everybody know that this lecture series is going to be taking place Sunday starting at noon, right there, 12 to 1. BaystateHealth.org is how you register for this because they are virtual, typically over at the Whitney Ave location, I believe. But you guys kind of switching with the times and going virtual. Doctor, any last things you want to say to the viewers about what they can look forward to with this series?
Absolutely. I'm looking forward to speaking to them about it. I think it's a very important topic that everyone has to be aware of. It's a very common issue. And I look forward to answering any questions or concerns that they may have.
There you go. Dr. Fadi Shahhoub, thank you very much for coming on today. Best of luck to you in this series, and thanks for what you do.